Hi, everybody. Welcome to the Missouri Rural Crisis Center's last Ask Me Anything about Missouri Medicaid and disability. My name is Dina Van der Zalm. I'm the healthcare organizer for the Missouri Rural Crisis Center. If you don't already, I would invite you to like and follow our page so you can get familiar with our issues and what's going on. I also would invite you to follow our co-hosts page, Paraquad. We'll hear from them here just in a second. In fact, let's go ahead and bring on our first expert. Her name is Sarah Schwegel. She is the public policy and advocacy specialist with Paraquad. We're thrilled to have her. As we are about to jump in, I want to do a couple of quick kind of housekeeping things. So if you have any questions, feel free to chat them below, and we will make sure we get to as many of your questions as possible. Closed captioning should be available in the bottom right-hand corner, and we will have an interpreter on screen at all times. I also want to invite Sarah to give a visual description really quickly before we jump in. So I'll start. Again, I'm Dina. I am a white woman with medium length brown wavy hair. I'm wearing a light pink shirt. And I am sitting in my guest bedroom with teal colored walls. Sarah, thanks for joining us. You want to give yourself a quick description?
Yeah, thanks for having me. So I am a white woman. I have blondish hair. It's a little bit past shoulder length. It's in a side ponytail. I'm wearing a pink dress with flowers on it, sitting in a wheelchair. And behind me, there's a green wall with a window with the shades closed.
Fantastic. Thank you so much. To get started, just so folks are familiar, tell us a little bit about Paraquad and then what y'all do.
Yeah, so Paraquad is a center for independent living whose mission is to empower people with disabilities to increase their independence through choice and opportunity. It was founded in 1970 by Max Starcloth, and we're one of the oldest centers for independent living in the country. Paraquad's guiding principles are to advance the independent living philosophy. We are working to make it possible so that people with disabilities can live integrated in their community.
You guys are such a vital asset to us here in Missouri. We're so grateful to have you. To kind of get us started, you know, I think when people think of Medicaid, we often aren't thinking about, we're thinking about just the health insurance part of it. And we know Medicaid is playing such a vital role in supporting people with disabilities. So what are, you know, some of those really important services? Tell us about that.
Yeah, so in addition to providing healthcare coverage for people with disabilities under the Age Blind Disabled program, it also covers home and community-based services, which allow people to live independently in their own homes, not nursing homes. An example of a community-based service is personal care attendants. So there's several ways that people with disabilities can access personal care attendants. One is through the in-home program, where an agency will send a personal care attendant or PCA to your home. One is the consumer-directed program, where you are able to hire and fire your own attendants. And then there's also waivers that provide nursing services, help pay for transportation. There's a lot of other programs that people can use as well.
And I think, you know, when we talked about these, I know these services make a huge difference. We've seen, you know, in Missouri, some policy changes in the last year that are impacting services a little bit. And we're hoping that another expert can join us here in a couple of minutes, Tyra, and tell us a little bit more about her personal experience. But I'm wondering if you can tell us a little bit about the kind of like legislative battles Paraquad has been fighting for advocacy, because, you know, it sounds maybe like not a big difference, the number of hours people can have an attendant or something. But what does that look like in people's daily lives?
Yeah, so I believe it was in 2016, there was a pretty significant cut to the consumer-directed services programs and other attendance services, and people were limited on how many hours they could receive. So folks who were getting 6 hours a day of attendance services got cut down to about 4 hours a day, and that 2 hours really makes a big difference. I personally use attendance services, and in those 2 hours, that's using the restroom or making dinner that I have to sacrifice. So it's a lot of personal sacrifice. Sometimes you have to rely on family and friends who may not be able to always help for free, and it can just put you in a really uncomfortable position. Another program or issue that a lot of people with disabilities face is income caps and asset limits. And these are associated with all of Medicaid. So even folks who aren't necessarily disabled face this as well. But people with disabilities who are able to work and want to work but need attendance services have to stay under a certain income cap and asset limit, and I believe that's $5,000. It just got increased to on July 1st. So that's really difficult for a lot of people because that limits the type of jobs they can get. You can't be a software engineer and make poverty level. That's wage discrimination. So something that we're working on is a Medicaid buy-in program, and we have been working to get that passed for the past several years. That would allow people with significant disabilities to work and earn a income and pay into their Medicaid on a sliding scale so that they can maintain their attendance services.
That's so important, like you said. I mean, especially to give people that control, that independence, that is so important. So I think we have Tyra Williams also joining us here. If we can go ahead and bring her on the screen. Hi, Tyra.
Hey, Tyra.
Oh, how is everyone this afternoon?
We're doing great. So Tyra, you are a Medicaid ambassador with Paraquad under their Community Voices for Medicaid program and a disability rights advocate. We may have a slight screen glitch here. When we get Tyra back, we're really excited to hear some of her personal stories with Medicaid, because the lived experience is just so much more important. Hi, welcome back. Tyra, do you want to do a quick visual description of yourself for folks?
Oh, well, my name is Tyra Williams. I am a Black African American with a disability. However, I wear glasses, and right now I have burgundy curly hair. And yeah, so that's about it.
We are thrilled you could join us. If you're ready, I would like to open it up, Tyra, and ask you just a little bit about, first of all, yourself. So how has having a disability impacted your life as you've grown up?
As I've grown up, it's a little different. It's impacted my life because not only do I have to deal with the everyday life struggles that everyone has to deal with, it's been difficult because you have to make sure it's accommodating to you based on the type of disability you have. Like the school I went to wasn't quite wheelchair accessible. They had some things, but they didn't have, it wasn't wheelchair accessible like it should have been. So going to high school or middle school, they actually hired someone to help get me up and down the stairs. everywhere there were stairs. So they actually hired someone to help get me up and down the stairs. There were certain classes that I couldn't take uh because I was unable to get to them. So also I had to take some of the same classes over for because of that. They couldn't get I couldn't get to the classes, so I took the same classes over. And it also, every time the some of the teachers would be asked to come down, it would make the rest of the class mad because they had to be taken out of the classroom and moved to a different classroom just so I could attend class. And that was something that I had to struggle with through middle school and high school. Also, like the parts uh that were ADA compliant seems to be where everybody goes to like hide out when they want to smoke or when they want to do something like ignorant, like use the bathroom or something, because they never thought they would get caught because they like, who gonna be back here? And I'm like, I'll tell you who gotta use those areas. Those areas are people with disabilities. That's why you got caught, because I was a person with a disability who had to go where everybody thought nobody will go here, like they do stupid stuff like that, like on elevators, even in our community. You get on those elevators and they are nasty, and you're like, who did this? Like, have you all ever catch like your transportation uh uh like metro or something? You ever use the metro link and you gotta go up on the platform and you get on those elevators and it smell like a bathroom or something? It's like, I guess they couldn't make it to the bathroom, or maybe they thought nobody was ever going to come in this elevator. So it's just always been difficult. So what I ended up doing when I was in school, by the time I got to high school, before I left and went to a transition program, I wrote a grant. I wrote a grant to try to help them out to make it better for the people that came after me. Even though we, my assistant that I had at that time said this could take a long time to come through. This could take years to happen. I was like, I know, but we got to get the ball rolling somewhere. So I took part in that. But the only thing that I did not want to take part in was having I didn't want the credit for doing it. I didn't want to be the poster child, for doing it, because I felt like it was nothing to be a poster child about. It should have already been done, without having to make a big uproar or no being on camera like I did something good when it should have already been there. So
Absolutely.
that's why I wanted to keep it quiet. I didn't want no big credit for something that should have already been there.
And it sounds like, that is a huge accomplishment. And it sounds like, growing up with a disability, you had to learn to be your own advocate in a lot of different spaces.
Oh, yeah, but yep. And sometimes I had to get totally fed up before. I'm like, how we are. We do get pissed off, but you can't always go like the angry, negative way. You have to go the respectable, positive, and educated way. You have to be, you have to handle it professionally.
Very true. I want to take we're getting a couple of questions in, which is great. And then I want to talk, Tyra, a little bit about your personal experience on Medicaid. But first, this seems like maybe a question for Sarah. wanting to talk a little bit about those spin downs.
Yeah, I'm actually going to throw it to Tyra for this one because
Okay.
I think she might have some personal experience with spin down.
Oh yeah. Okay. So, I do have some personal experience with some
Okay.
spin down.
Do
Okay.
you want to explain what a spin down is first?
It's like you have to pay to keep. Okay, so like you get Medicaid and Medicare, and okay, so you get Medicare through, I think, Social Security, and then you get Medicaid through, of course, your state or what have you. So then you have to, they'll ask you to pay a spin down based off of your income. Um, and based off of your income, they might ask you to pay a spin down for Medicaid or Medicare, and it's based off of your income. So they'll tell you, like, if you're not working, it's actually more. It could be actually more, like it could be maybe $300 or something more. But if you're working and you have a disability, there is something called Ticket to Work, and that's actually cheaper, but you can only get that if you're working. And sometimes they request proof all the time. So you just got to be on your toes all the time because dealing with medical insurances, it, those letters come out, they come in every day. So you just got to be on your toes all the time.
Yes.
Can't sit down on it because you never know when those letters are going to come. What I have a problem with understanding, but I don't have a problem with understanding. I just go with it. But what's weird to me is the fact that it's more when you're not working versus when you are working. When you are working, it's less. When you're not working, it's more. I don't understand it. I just go with it.
Yeah,
But
there's a lot of confusing parts about Medicaid. Those are one of the reasons why it's more expensive when you're not working is work incentives. So they're trying to get you to work. And they want you to actively participate in your community. But when you're on a spend down, you actually have to pay your full spend down amount before your Medicaid will kick in every month. So if your spend down is $300, you have to spend $300 on medical expenses before your Medicaid will begin for that month. So if you have personal care attendants that you need to working on the first of the month, Medicaid won't pay for that until you meet that $300 spend down or what have you.
Yes. Matter of fact, speaking of that, what I do is I just go ahead and pay the amount that they're asking me to pay. I get a letter every month that says you have to have your medical insurance paid, and it'll have the amount. They'll mail you the amount every month, and they'll mail you have to. I just go ahead and pay it, and you have to have it. I think mine has to be paid by the 25th of every month because that's when it processes normally. Because if you mail it late, then it can fall behind or sit on somebody's desk, or they can it ain't no telling when they could put it in a computer, and that means that your attendance that you have coming in won't get paid, which is why I was kind of running late today because my attendant came in and helped me with a shower, which is why I look, the way I look. And I feel the way I feel because I had help today, and it wasn't a struggle when you have your own attendant coming in of your choosing, and you're comfortable, and it helps you to go on with your everyday life.
Absolutely. It's a huge part of it. I want to quickly touch on this question, and I don't know which of you wants to answer this one, but it's a good one. So how are they determining the amount and eligibility that we're setting for Medicaid for people with disabilities?
Yeah, so when you apply for Medicaid, you have to submit a whole bunch of documentation, doctor's notes, what drugs you're taking, everything. They want to know all about you. And then when you are applying for personal care attendant services, so either the consumer directed program, the in-home program, or one of the waivers, they will send someone to your house and do a physical assessment on you and ask you about your level of functioning. Tyra, you're nodding along. Do you want to kind of share your experience with that process?
Yes, they do ask they do come out and do a personal assessment. Honestly, I know you all might find this funny, but if they don't come out and do that personal assessment, I feel kind of funny. I'm used to them being in my business now. You know, they look at your medications, they make sure you know what medications you're supposed to be taking. They look at your house and the way you got it set up, and they look at how clean, you know, if it's clean, and you know, they want to know how much you could do for yourself. You know, they want to know how much you could do for yourself, and you know, and even though you need an attendant, like up to a certain age range, like up to a certain age range, like for the in-home program for a young person, they might not get as many hours as an older person would need, based off of how important your needs are. You know what I'm saying?
Yeah, so they actually have a point system that they use. So based on your level of functionality, they assign you points, and X number of points earns you X number of units. X number of units equals X number of hours. And it is a very complicated algorithm, and I still don't have it figured out. I just know that every time they do my recertification, it's nerve-wracking because you never know if they're going to decide that your disability has magically gotten better.
That's actually, so I had a question. You talked about when you were applying that they did all of this. We know that you have to do these, is it an annual reassessment? And is it the whole shebang every time? What does that look like?
Yeah, so every year to be recertified for Medicaid, I'm sent a yellow packet. I don't know what color it is for you, Tyra, but for me it's yellow, and it's the yellow packet, and it's about 20 pages long, I think.
Yes.
And all sorts of questions about doctors, your bank accounts, so much information.
Your bills, they want to know everything.
Yeah, where you're living, who's living with you. If it's something about your life that you feel is probably a little personal and you don't really want the government to know, they're going to ask.
They're going to ask, no matter how comfortable and gut bothering it may be, because when you have to go through all that, it makes your stomach drop.
Yeah.
For me, just even seeing that, like, I just recently got a call from Health and Senior Services saying we need to do your annual research. So what I did was I called my specialist at Paraquad, because I'm like, are you sure it's time? Can you check that? Because you never know if they're going to continue to give it to you. Speaking of that, I probably should return their call. I did return their call, but they didn't call me back. They said because of the pandemic, they were doing it over the phone. And I'm like, I'm feeling kind of funny, because I'm like, no, I need you to come get all in my business, because you might cut something that I really need.
Yeah. And then, so that packet is for Medicaid as a whole, and then for your personal care attendant services, that's a little bit different. And I think folks tend to be on a different schedule. So I have monthly check-in calls with the agency that I work with, so Paraquad. They check in with me once a month, and then every other month I get a call from Medicaid and they check in. And then sometimes, but I don't really know when because it's never really, never super regular. I'll get a call from somebody at the state who wants to make sure I am still in fact disabled.
Well, that is so helpful. I mean, that we can't streamline this process a little bit. We have a question. So this is for Tyra here. We talked about how you are a self-advocate because you kind of naturally have to be. What advice do you have for folks who are just learning how to start speaking up for themselves?
What I have for advice.
Uh-oh.
It was such powerful advice.
I know. It made her camera connection back.
Well, we will hold that question for when we get Tyra back. I have another question I hear from Sarah. Yeah, maybe you can touch on this. So how are they determining if folks are going onto the Medicaid managed care plans versus straight Medicaid?
Yeah, so that's a really good question. From my understanding, and I could be wrong, so I'm happy to follow up with you on this. But from my understanding, they are keeping the aged, blind, disabled program out of managed care. So that's completely separate. So if you're not on aged, blind, disabled, then it's more likely that you are going to go into a managed care program. I know that this could change soon. There's not, we don't totally know what's happening with the whole managed care thing, and that might depend on Medicaid expansion if that happens. So right now, age blind disabled is not under managed care.
Yeah, I feel like there's like always the disclaimer of like, today.
Yeah.
Sorry.
Right. I don't know. Check back in 3 hours, it might be different.
Exactly. I wanted to touch on a little bit. You talked a little, Sarah, about the process of applying for Medicaid. A lot of folks with disabilities, you're on as a kid. Can you speak a little to that transition when you become an adult and you're now having to apply for the next level of Medicaid here?
Yeah. So the transition process is different for everybody. For me, I was on Medicaid as a child, so it was fairly seamless. I switched from the Healthy Children and Youth program. I was able to choose what waiver and what attendance services I wanted. I chose the medically fragile adult waiver because that one fit my needs the best, and then consumer directed services. There were some sticky spots where we had to advocate because they did not want me to live on my college campus, but we were able to explain to them that I technically am still living with my parents, just on campus for a little bit, and they were like, oh, right, sure, that makes sense. So everything got straightened out. It's a lot of advocating for yourself and explaining your needs.
Absolutely. That'll be a good segue. So Tyra, I want to open that up to you as well. We were talking about what that transition from when you were a kid on Medicaid to applying to be an adult as a person with disabilities on Medicaid, what that sort of transition process was like for you. And then we'll let you talk about what your advice for advocates, because as Sarah said, you're advocating for yourself all the time. So what your advice for new folks is.
Yes. Well, what I noticed that when I was little, you could get more on Medicaid versus when you get older, it kind of changes and you have to have Medicaid and Medicare. The experience that I had when I was older was that I had to become my own advocate. I had to take over being my own advocate because your parents kind of get tired, or you may have lost them or anything. So that's what I've experienced. Just recently, I've been having to go back and forth about my Medicaid and send in check stubs, even write a little letter saying, hey, could you contact me before making these changes? Or I've been hit like 4, 5, 6 times when you're only supposed to be hit like every quarter or every, you're only supposed to be hit every maybe 6 months or every quarter, whatever the state says. You're not supposed to be hit 4, 5, 6 times, out of 1 month or even 2 months. You're supposed to have a break from that. Like, ain't nothing gonna change between now and then. So, yeah, I've had to send in emails. I even started sending my check stubs in every month without them asking, because I would get letters in the mail about it. Requesting my check stubs from my job. And I'm like, ma'am, if you look into the system, I already sent them in. Because
Yeah.
every time
Proactive as possible.
every time you put them in the system, every time you send them, they put them in the system. But then my last situation was, the lady kind of got snobby with me, and I just thought it was because she was working from home. She was working from home because she was snobby with me. She was like, well, if you stop sending in your check stub, we wouldn't have to change it, because every time you send in your check stub, then we have to enter it into the system, and then it changes. I'm like, but my checks really don't, the check amount really doesn't change. So how does it make a big change? So anyway, needless to say, with that, I stopped sending in my check stubs. So we'll see how that goes.
I want to just I know I want to be aware of time of what we're asking of you guys, but Tyra, if you could just speak a minute about the ways you touched on this already, but just naming sort of what some of those Medicaid supports that make living independent possible for you. Why is it so important in your life?
It's very important in my life. First of all, what I recommend is every opportunity that's out there, like Paraquad, if any caseworkers, that any government funded caseworkers that you can get, like Voc Rehab, Regional Center is a very good one to have behind you, because they can also come in and help you advocate if they need to. Documentation when you're doing this stuff is very important. Having documentation, so anytime you're doing or speaking to someone, write it down, take a picture, fax it, send yourself emails, have your own backup of documentation. You might need that documentation maybe 2 or 3 times. I know it seems crazy, but it helps throughout all this. And also, my advice when dealing with this stuff is have a lot of patience. Have a lot of patience. And even I have to work on my patience and not getting angry, because getting angry doesn't help. It's not going to help the situation. And I'm trying to live by the advice that I'm giving you now. I take that in day by day. So using caseworkers, having like Paraquad behind me, may work. And sometimes, like in the pandemic, we haven't always been able to get in touch with them. So it is very good to be your own advocate. Even if you can't write, my handwriting is not that good, but I sure got a mouth on me. But also know how to educate, respectably use your mouth, because you get more, what's that saying, you can catch more bees with honey. So in other words, even though you're frustrated, try to be as polite and respectable as you can, you know so then you will get what you need to get done. and then you might have to call back more than once. You know, it's a battle, but you know, that's what it's all about. That's what being independent and being your own advocate is.
Absolutely. And it sounds like, you know, it takes a village. So getting that big network of support is really important when you can. But yeah, being not afraid to speak up for yourself is huge. Sarah, did you have anything you wanted to say about being your own advocate and services?
Yeah, self-advocacy is so important. If you want help learning how to be a self-advocate, definitely reach out to Paraquad. We have an advocacy training. Reach out to your local Center for Independent Living. There is a Center for Independent Living in almost every county in Missouri. So you can get support and services and live your life as independent as possible.
And we can, I know folks, if you have some more personal questions or circumstances, if you want to follow up, I think we can drop Sarah's email information into the chat for folks later. She's a great person to follow up with. But I just want to thank so much Tyra and Sarah, both of you, for joining us. I think this has been really great. And thank you so much, everyone, for coming to our last Ask Me Anything Medicaid.
Thank you for having us. And thank you, Brett, for interpreting.
Absolutely.
Thank you so much. Awesome interpreting.